What happens if blood goes to your brain? A question that might have you scratching your head, but one that holds significant importance. Now I know what you're thinking. Doesn't blood always flow to the brain? Yes, but we're talking about something different here. Something a bit more sinister. When blood gathers where it shouldn't in the brain, it can lead to serious conditions, like a stroke or a brain bleed. Think of it as a pool of unwanted guests at a party. They're taking up space, causing chaos, and depriving your brain of the oxygen it desperately needs to function properly. And when this happens, time is of the essence. Immediate medical attention is not just crucial, it's life-saving. But don't worry, we're not here to scare you. We're here to inform you, to help you understand this vital topic. So are you ready to dive into the depths of this fascinating and vital topic? Stay tuned. Ever heard of a brain bleed? It's as ominous as it sounds. Imagine a silent thief in the night creeping into your sanctuary. Instead of taking valuables, this intruder steals something far more precious: your health. This is the reality of a brain bleed. Also known as an intracranial hemorrhage, a brain bleed is a type of stroke where blood pools between the brain and skull. This pool acts like a barrier, cutting off vital oxygen supply to the brain. The brain, like any organ, needs oxygen to function. Cut off its supply and it starts to die. But what causes such a catastrophe? Brain bleeds can result from a number of incidents. A simple fall, a traumatic injury, or a silent threat that many of us live with every day. Unmanaged high blood pressure. Each of these events can cause a blood vessel in the brain to rupture, leading to a brain bleed. As for symptoms, they can be as sudden and shocking as a bolt of lightning in a clear sky, a severe headache out of nowhere, a sudden wave of confusion washing over you, or an unexpected numbness creeping up your body. These are not symptoms to be ignored. They are your body's alarm bells, ringing loud and clear. This condition is life-threatening. It can lead to permanent damage, robbing you of your mobility, your speech, even your life. It's not a condition that can be shrugged off or left to chance. It's a medical emergency that requires immediate attention. So what's the takeaway here? Brain bleeds are no laughing matter, and recognizing the symptoms could be a lifesaver. Knowledge is power, and in this case it could be the power to save a life, maybe even your own. Imagine you have the symptoms we just discussed. What's the next step? You might be feeling a sudden headache, confusion, or even numbness. These could be signs of a brain bleed, a type of stroke that requires immediate attention. But how do we confirm this? The diagnosis process for a brain bleed is meticulous and thorough. It begins with a physical exam where doctors check for high blood pressure and other signs of a stroke. Then, they conduct a neurological exam to evaluate your brain function. This might involve testing your reflexes, muscle strength, eye movement, and even your ability to understand and produce speech. However, these exams are just the first step. To get a clear picture of what's happening inside your brain, doctors rely on imaging tests. A CT scan, which stands for computed tomography, is often the first test done for suspected brain bleeds, as it can quickly visualize the brain and show any bleeding or clots. Sometimes, an MRI or magnetic resonance imaging might be used. It provides a more detailed image of the brain and can help doctors identify the exact location and extent of the bleed. In some cases, doctors might also perform a lumbar puncture, commonly known as a spinal tap. In this procedure, a needle is inserted into the lower part of your spine to collect cerebrospinal fluid. If there's blood in this fluid, it could indicate a brain bleed. The diagnosis process is crucial in detecting a brain bleed. It's not just about confirming the presence of a bleed, but also understanding its severity and location. This information guides doctors in deciding the most effective treatment plan, from medications to surgery and even rehabilitation. Diagnosis is the first step towards treatment, but what does treatment involve? Let's find out next. A brain bleed is a medical emergency, and treatment must begin immediately. It's not just a saying, it's a crucial reality. The course of action depends largely on the severity and location of the hemorrhage. In some cases, medications might be enough to manage the situation. These could include drugs to lower blood pressure, prevent seizures, or reduce swelling in the brain. However, in more severe cases, surgery may be necessary. This can involve drilling a hole in the skull to drain the pooled blood, or even removing a portion of the skull to alleviate pressure. It's a high-stakes operation, but when it comes to saving a life, every second counts. Once the immediate danger has passed, the journey towards recovery begins. This is where rehabilitation comes into play. It's not just about getting back on your feet, it's about reclaiming your life. Rehabilitation could involve physical therapy to regain strength and mobility, occupational therapy to relearn daily tasks, or speech therapy to improve communication. It's important to remember that every recovery journey is unique. The length and intensity of rehabilitation depend on the extent of damage caused by the brain bleed. Some individuals may regain most of their abilities within a few months, while others might need years of therapy. It's a long road, filled with challenges and triumphs, but every step forward is a victory. The role of loved ones in this process cannot be overstated. Their support, encouragement, and understanding can make a significant difference in the recovery journey. They are the cheerleaders, the sounding boards, the pillars of strength that help turn the impossible into the possible. With prompt treatment and rehabilitation, survival odds increase. But prevention is always better than cure. So let's focus on keeping our brains healthy, our blood pressure in check, and our helmets securely fastened. After all, we've only got one brain. Let's do our best to protect it. Preventing a brain bleed starts with managing risk factors and wearing protective gear. It's vital to keep conditions like high blood pressure in check, as unmanaged high blood pressure can lead to this life-threatening situation. Regular checkups, a balanced diet, and an active lifestyle can go a long way in maintaining your health and reducing the risk of brain bleeds. If you're into physical activities that might pose a risk of falls or traumatic injuries, don't forget to gear up properly. Helmets can be real lifesavers. Let's take a quick recap of what we've covered. We've delved into the curious case of blood in the brain, explored how brain bleeds are silent threats, discussed how they're diagnosed, and looked at various treatment and rehabilitation methods. Knowledge is power, and being aware of these aspects can help you take prompt action if the need arises. Remember, understanding what happens if blood goes to your brain could save a life. If you found this video informative, don't forget to like and subscribe. Stay healthy, stay informed.